Hello, my name is Patricia Niebauer, and I'm a North Carolina licensed attorney practicing here in Pinehurst, North Carolina. And today we are talking to you about a healthcare power of attorney and an advance directive for natural death, which is also known as a living will. And we're going to go through these forms, and I'm going to explain all the different sections and explain how to fill them out. Healthcare powers of attorneys can take many different forms, but today we are going through the ones that are offered free of charge at the North Carolina Secretary of State website. So if you go to the North Carolina Secretary of State website, you can find these forms, download them, and fill them out. Nothing in this video shall be construed as creating an attorney-client relationship. This video is for informational purposes only. And so if you have any further questions about these documents, I would encourage you to consult with an attorney. So a healthcare power of attorney is used to designate one or more trusted friends or family members to make healthcare decisions for you in those cases where you are unable to communicate your healthcare decisions, or you are incapacitated to such a degree that you cannot make those decisions yourself. It's very important to have a healthcare power of attorney, not only because it avoids having a guardianship proceeding and having the court decide who your guardian is going to be, but it also puts you in control of deciding under what circumstances you want life-prolonging measures provided or withdrawn. Now we're going to turn to go through each section of the healthcare power of attorney. So section 1 of the healthcare power of attorney is the section in which you designate who those healthcare agents are going to be. It could be one or more individuals, or you can put them in a sequential order. If your primary healthcare agent is not reasonably available, your doctors will automatically look to the alternate listed agent to make those decisions on your behalf. Section 2 states that the healthcare power of attorney does not come into effect until such time as your doctors determine that you lack capacity to communicate medical decisions. And so you can designate a physician to make that determination of capacity, or if you leave it blank, it would be the attending physician making the decision. Section 3 states that you can at any point revoke your healthcare power of attorney designation. So if life comes along and you decide to change who your healthcare agents are, you can certainly do that. I would just recommend that you let your prior agents and your medical providers know that you've revoked it, and also destroy all prior copies of the healthcare power of attorney. Section 4 goes through a general list of all the things that a healthcare agent can do on your behalf, which include consent to medical treatment, consent to admissions to the hospital and surgery, admissions to nursing home, and all sorts of medical decisions on your behalf. Now, Section 5 is a section where you can initial certain choices to provide further instructions to your healthcare agent. Section 5A deals with whether your healthcare agent and your medical providers can provide artificial nutrition or hydration, or whether you want those discontinued. And so you can write in your instructions and make your selection as to artificial nutrition and hydration. Section 5B allows you to provide more specific instructions to your healthcare agent regarding any instructions you want to leave on your medical care. So you can be more detailed in that section and say, I want this done or not have that done. Section 5C talks about whether you have any provisions that you want to make clear regarding mental health treatment. Now, there is a separate mental health power of attorney, advance directive, that's available as well in the Secretary of State website, and you can print that out and fill it out if you feel so inclined to do so. Section 5E allows you to write in instructions and say whether your agent can request an autopsy after your death and whether they can decide your burial and funeral arrangements. And you can provide instructions if you want to leave instructions about being cremated or buried or where you want your remains laid to rest. Section 6 allows you to specify whether you want your organs or your body donated after your death, and again, you can provide instructions regarding those matters. Section 7 states that if it's necessary for the court to appoint a guardian on your behalf, that you would want the individuals listed as your healthcare agents to serve as your guardians. Section 8 and 9 state that anybody, your medical providers, your healthcare agents can all rely on this document as an expression of your wishes, and that there is no liability for them following your wishes as you've set them in this document. Lastly, healthcare power of attorney should be valid not only in North Carolina but across state lines as well. And when you sign one power of attorney, any prior ones are revoked. Lastly, the power of attorney needs to be signed before 2 unrelated witnesses and a notary public. And those witnesses cannot be employed by the hospital or by your medical provider, so you will need to locate some independent witnesses. Now we're turning over to the Advance Directive for Natural Death, which is also known as a living will. The living will's purpose is to determine under which circumstances you want life-prolonging measures discontinued. A living will applies under 3 specific medical circumstances. The first one being if you have an irreversible and incurable condition that will result in death within a relatively short period of time. The next situation is if you are in a coma, unconscious, and unlikely to ever come out of that situation. The third and last situation is advanced dementia, Alzheimer, or cognitive loss that's not reversible. In the living will, you can select under which of those medical circumstances you would like for life-prolonging measures to be discontinued. So you can select all of them or just any one of them. The next section, Section 2, asks you to decide whether the doctor has the discretion to discontinue life-prolonging measures in those circumstances, or whether you want it discontinued if that's your medical condition. So option 1 is to let the doctors decide. Option 2 is more black and white. You don't want further measures if you're found to be in any of those medical situations we discussed. Section 3 says that you can choose whether or not you will receive artificial nutrition and hydration, even if all other treatments are discontinued. So you can select your options and provide instructions regarding artificial nutrition and hydration. Section 4, it's a statement saying that even though measures will be discontinued, that you still want to be kept clean and as pain-free as possible. Section 5 is an affirmation stating that you understand the decisions that you're making and the fact that you are requesting that life-prolonging measures be discontinued. Section 6 allows you to state whether your healthcare agent has the power to override your living will. And so the healthcare agent which you nominated in the power of attorney, if you select that option, they can decide whether or not to discontinue measures. Or you can say, no, my living will stands and it cannot be overridden by my healthcare agent. The rest of the document, Section 7, 8, and 9, is your affirmation stating that you want your living will to be followed by your medical providers and your healthcare agents, and that it is valid immediately if the circumstances arise. And then nobody has liability for following your living will as you've stated in this document. Lastly, the document needs to be signed before 2 unrelated witnesses and a notary public. And then there is an opportunity as well, once these are signed, that you should share them with your healthcare agents and your medical providers, and you can even email it to First Health at an address that will be linked in the website, where you can email these documents, and once they are uploaded to the First Health website portal, they'll be shared across all the providers who are part of the First Health network.